Hello and welcome to Aging is for Everyone. I'm Laura Mondello and I'll be your host for the show. Today we're talking about changes in healthcare, and here to tell us about some changes that are coming to Medicare is Bill Daniels, who is with the Erie County Department of Senior Services. Welcome, Bill.
Welcome. Glad to be here today.
It's great to have you here. There's a lot of controversy about the Affordable Care Act, Obamacare. You know, a lot of people are against it, but there's some changes to Medicare in the Affordable Care Act that people need to know about. Can you tell us what those changes are?
Yes, it's actually a good thing for an awful lot of people with Medicare. Mm-hmm. They're going to do very well with the Affordable Care Act. There's preventive services that used to have a 20% copay. Mm-hmm. Now there's free, no copay for these people.
Great.
A big issue is prescription drug cost.
Right.
Okay, there's a gap right now that is huge after initial coverage. That gap is being shrunk down by the Affordable Care Act. Mm-hmm. So by 2020, the gap will disappear.
Great.
For next year, 2014, you get a 53% discount on brand name drugs. So that can save an awful lot of people a great deal of money.
Right. Right.
Okay. It's holding doctors more accountable. It's holding hospitals more accountable. Mm-hmm. It's holding insurance companies, the Medicare Advantage plans, more accountable to provide better service for people on Medicare.
Right, right. So it's doing a lot of good things for folks who
Definitely.
are on Medicare. As far as like some of the, you mentioned that there won't be a copay for certain procedures. And what are those that they won't have to pay a copay for?
There's quite a few. For mammograms, copay is gone. Prostate, quite a few. There's a whole arrangement.
Okay, like colonoscopies.
Colonoscopies,
like
yes.
Okay, so
that's all going away.
That's great, and hopefully that will encourage more people to get those tests early.
Yes.
Take better care of themselves.
Yes.
Instead of worrying about that 20% copay that used to be there. Mm-hmm. That's terrific. Now you mentioned some changes in the Medicare Advantage plans for 2014. Can you just go over those a little bit more in depth?
Yes, the Medicare Advantage plans are going to be held more responsible for the quality of the care they provide.
Right.
Okay, there's financial incentives for them to do better. They're rated on a 1 to 5 star rating.
Okay.
And if anyone's interested, call my office. I'll tell them exactly how those ratings are determined. The local ones here usually have between a 3 to 5 star rating. And some of your out-of-state plans are maybe 3 to 3.5.
Okay.
Okay, so, which is important because 54% of people in this area have a Medicare Advantage program.
Okay. And how many different Medicare Advantage programs are there for people to choose from locally?
Well, there's about five different companies, and each one might have a half dozen different plans.
Okay, so when people are looking, you know, they really need to look at what's in each, what each plan offers.
Plus, there's the Medicare supplemental plans as well.
Right.
So there's a great deal of choices.
Right.
So much for, it's like trying to choose a breakfast cereal from a supermarket aisle. There's so many choices, it's difficult for a lot of people to do it on their own.
Right, right. And then you mentioned that there's changes in Medicare Part D coverage for people. So, you know, a lot of people may just get their Part D and stick with it, but that's maybe not the best idea?
Not the best thing to do, because they can change these plans every year.
Right.
And they do.
Right.
They can change their formulary, the medicine that they're going to cover. They can make changes and things such as they require step therapy. So the doctor order one medication, but the insurance company may not necessarily cover that.
Okay.
Or they can require quantity limits, or they could require prior authorization. And for the same medication, it might be all three.
Okay.
Before they will cover it.
Okay, so somebody may assume that their plan that works for them this year is just perfect, but they really need to look at what the changes are involved for the plan for the next year.
Yes. It's difficult for the consumer because you almost have to project your needs for the following year.
Right.
Some people have special enrollments, so if they're locked into a plan this year, it's not necessarily locked in for good.
Okay.
For example, if they have EPIC, elderly pharmaceutical insurance coverage, they can make one change outside the annual enrollment period.
Okay. Okay, that's good to know. That's good to know. And as we said, there's a lot of choices for people to choose from, but it's got to be very confusing for some folks. How can they get help?
They can call us. Now, we do not sell insurance. We will give you 2 or 3 options, and we'll leave it up to you to make the best choice for yourself. But we will give you an educated choice. We'll tell you how well the plan is rated
Right.
by the Centers for Medicare and Medicaid Services. We'll tell you about restrictions. It's important if you choose an HMO model to make sure your doctors are covered by the insurance company. And
Right.
it might be a network restriction as well.
Okay.
Certain hospitals may not be included. So it's very important to know. A lot of people here, like I said before, like the Medicare Advantage programs because they're low premium.
Right.
But you have to live with the restrictions of the insurance company.
Right, right. Now, if somebody has particular medications that they need to take, you know, when they have their doctor, is there somebody available that can kind of go over with them individually?
Yes. If they call us, the first thing we ask person is, what kind of medicine do you take? What are the names of your medications? We check that first. Because doctors, you know, prescribe medication, and what good is it if you can't get it covered?
Right, right.
You know, we also have people, besides our office in the Raft Building downtown Buffalo, we have people in Hamburg, we have them in Orchard Park, Tonawanda, Amherst, and Buffalo that can meet with one-on-one.
Okay.
In addition to our Raft Building office.
Which is good to know because,
Yes.
I mean, I know that you can do a lot of this on your own on a computer, but some of the older adults maybe don't have a computer or aren't that computer savvy.
That's the case a lot of times, but it's, like I said, that's why we're there, and we enjoy what we're doing.
Right, right. And I know this time of year you guys are out and about a lot.
Yes, we are.
Doing a lot of education for people.
Yes.
So
And we have an unbiased comparison between all the plans,
right.
all the Medicare Advantage programs, line by line, what your co-pays would be. Okay, but it's up for the person to make sure the doctor accepts the insurance.
Right, right. Okay.
Okay.
So folks can really get more information by going to the Department of Senior Services website.
Yes.
And also we have your email and we have your information on the screen so
Great.
folks can get in touch with you.
Excellent.
Great. Well, thank you so much for being with us, Bill. We really appreciate it.
You're
and this is
welcome.
obviously important information. People really shouldn't just stick with that Part D plan forever. Thanks again.
Thanks. Thanks.
Thank you.
Thanks for the invitation.
Yes. We'll be right back with more Aging is for Everyone. Welcome back to Aging is for Everyone. We are talking about changes in healthcare today. And one of the things that is a big change over 10, 15 years ago are electronic medical records. Maybe your doctor's office has asked you if you're interested in getting online to see your test results. Well, maybe you want to know more about that. Well, our guest here, Daniel Porreca, is the Executive Director of HEALTHeLink, and he's going to tell us more about electronic medical records and specifically about HEALTHeLink.
Hi.
Hi, good to have you here.
Well, thank you. Thanks for the invitation.
I've heard about HEALTHeLink, but why don't you tell us, what is HEALTHeLink specifically?
Well, Laura, HEALTHeLink is the health information exchange for Western New York. We are the information highway that allows patient information to follow them wherever they go, wherever they seek treatment. So we have virtually every hospital in the 8 counties of Western New York connected to us. So the information or the data that gets generated in those hospitals flows through HEALTHeLink. We have over 98% of the labs, 95% of the radiology studies flowing through HEALTHeLink, medication history. So it's important because when a doctor goes to treat you, they need it to have as much information about you as possible.
Right.
We enable them to get that information quickly and efficiently.
Right. So if you've been treated in one hospital and then maybe you're in an emergency room in another hospital, those doctors can kind of pull up your records.
Right. Or if you go to a specialist, your primary care doctor may have information that can be shared, if you show up at a specialist's office.
Right.
We're very fortunate here in Western New York that we're a product of a unique collaboration between the healthcare payers and the major hospital systems that puts us in a unique position in the country, really. We are among the leaders in the nation for what we do.
Great.
And it's because of that collaboration that we are in that position.
Right. And was that one of the reasons why it was created, for the payers and the providers to really work together?
I think the collaboration goes actually back to around 2000, where an organization called HealthyNet was put in place. And I'm not going to get into the details of HealthyNet. It was an administrative data exchange. But what that did was it proved collaboration could work. It was a huge success by every measure. Those the 7 entities that I talked about, the 3 payers and 4 hospital systems, decided to expand that collaboration to the clinical. And really what it was meant to do is to try and improve patient care.
Right.
It's to drive down, and as a result of that, you can drive down cost. So we're talking about, the unsustainable path that we're on as a country relative to healthcare cost. One of the things that we can do to contribute to that issue and to that problem is make sure that doctors get the information they need, so they don't send you for another MRI or another CAT scan if you just had one a month and a half ago when you were hospitalized, for example.
Right. Now, the basis of HEALTHeLink is sort of the electronic medical record, and for those folks who don't know what that is, can you just explain? Right.
So the electronic medical record, as you referenced, in the physician office, within their 4 walls, this replaced the manila folder, right? They used to, during a visit, they would jot down the notes about the visit and then put it in a folder and then put it in one of the, line their walls with those folders. This replaces that, the electronic medical record, and so it really becomes a more efficient way for them to capture the information about you as a patient.
Right.
And then they can run reports that they couldn't have done previously. When it's on paper, you can't run a report about, for all my patients, who is due for the mammogram, who is due for the PSI test, PSA test, who is due for whatever. You can't do that when it's on paper. So that's a great start. What we do as an organization now is start connecting those. So when you go from your primary care doctor's office who has this information to the specialist or to the emergency room, as you talked about, how does that data flow? Well, you need a trusted entity that sits kind of in the middle of the community that enables the data to flow from point A to point B to point C. essentially following the patient wherever they go.
Right, right. So for the patient, what's the benefit for them in participating in HEALTHeLink?
Well, better care. You as the patient have the key to unlocking your data, and it's the patient consent form. With that consent, any doctor that you go to that is a participant in HEALTHeLink can look up the data on you that was generated elsewhere in the community.
Okay.
So the benefit to you is better, more efficient care, and the hassle factor goes away. You're not getting sent for tests that you don't need. You're not getting exposed to radiation by an X-ray or CAT scan that is not necessary.
Right.
So those are all good things.
Right, right.
And for the doctors, they can better treat their patients more efficiently. They have the information they need virtually at their fingertips.
Now, how many are like all of the medical groups and hospitals participating in this, or is it the majority? Or
Well, virtually every hospital in Western New York
Okay.
is participating, and we have nearly 600 other participants. So we have about 75 to 80% of the practices that are that have an agreement with a participation agreement with us. The use is expanding every day. The numbers are getting better and better. We need never as fast as I want it,
Right.
but we are certainly the progress is encouraging, and we're seeing the results.
Right. Now, can the patient themselves go in and look at their results in
Not
HEALTHeLink?
yet. So the physician offices with their EMRs have their what we call a tethered portal or a personal health record.
Right.
And we can feed data to the practice that can get into that.
Okay.
But HEALTHeLink at this point does not have the patient
Okay.
personal health record.
Okay.
But that's something that is certainly on the radar.
Right. Now, if somebody wants to make sure that their information is being shared through HEALTHeLink, how do they go about doing that? Is that something they do through their personal physician, or can they go to the HEALTHeLink website?
Yes, on our website you can download a form and make your selection, and if you want to consent to have your information shared with your doctors, you can check that, make that selection, sign it, get a witness if you're going to fax it in or send it to us.
Right.
You need to have a witness on it. Otherwise, at your physician office.
So you can just
physician's
tell your
office.
doctor's office, well, first of all, make sure that they participate in HEALTHeLink, and if they don't, ask them why, which will help you out a little
Great
bit.
question. Yes, yes.
And then they can, through their doctor's office, just sign up through there.
Yeah,
as
we
well.
find that patients, that's the place where trust is the highest.
Right.
Is when that doctor-patient relationship
Right.
means a lot. So if your doctor asks you to sign it, typically folks, 95% of the people who sign a consent form say yes.
Okay. Well, it sounds like great. It sounds great, and obviously, I think that there's definitely that benefit of being able to share those records among all those hospitals and practices, and hopefully, we'll get to closer to 100% participation by all the other physicians' offices soon.
And we're just starting, basically. We're really within New York State. So we have the 8 counties, the westernmost counties.
Right.
New York State is putting together what's called the State Health Information Network for New York. So if you get sick in Manhattan or in Schenectady or in Albany, that data will be available. And then take it the next step. If you're in Fort Lauderdale, your data should follow you there as well.
Great.
So this is just the beginning.
Great. Well, thanks so much for being with us.
Thank
Dan.
you. Thanks
we
for
really
having me.
appreciate it. Okay, and we'll be back with more Aging is for Everyone. And welcome back to Aging is for Everyone. We're talking about changes in healthcare today, and I'm happy to welcome Bruce Reynoso, who is an elder law attorney and a partner with McGavin & Grimm. Welcome, Bruce.
Hello, Laura. It's so nice to be here.
It's always great to have you on the show. There are so many legal issues regarding healthcare. You know, and I know we want to talk about a few of them, especially about making your needs known, or what you want known to people. And there's, you know, what do people need to have? What documents do they need to get done?
Before I say that, can I just give you congratulations on your Evan Calkins Award? Because it's an award for outstanding service to aging people in Western New York, and you won it, and you really deserved it. So I think it should be broadcast, and so I'm seizing this opportunity.
Thank you so much. And part of it was for the show, because we do try and get the word out there about positive issues and things that people need to know about the, you know, aging and aging well. So let's get back to it.
Well, I surprised you on that, but I'll answer your question. So, you know, some things don't change in the law and healthcare, and that's the importance of people having healthcare proxies. You know, that's the form that people use to pick the person they trust who's going to be able to speak out for them and make sure their wishes are known and advocate to be sure their wishes are followed regarding medical care. So that's really important. That doesn't change.
Right.
Now, maybe since the last time I've been here with you, New York has enacted the Family Healthcare Decisions Act,
right,
which in the absence of a healthcare proxy gives a list of people who can step in as surrogate makers and advocate on the patient's behalf. But you are much better off if you pick your agent using a healthcare proxy.
Right.
And there's another development that has been sort of coming in over the years, and it's a bright pink form, and you may have seen it.
Yes.
It's called MOLST, which stands for Medical Orders on Life-Sustaining Treatment. It's now the law in New York. It's good in all the counties. You'll encounter it most often in hospitals and medical facilities. And it's a form where the patient and the physician together go through a series of questions which have been carefully constructed so that when you're done with that, there's a medical order in place about your wishes on all kinds of things: respirators, resuscitation, antibiotics, artificial nutrition and hydration, et cetera. So that's a really good development over time. So
right,
I think that's pretty much it. Healthcare proxy, MOLST. And you know, everyone still needs to have a power of attorney, I think, so that it's a pair with a healthcare proxy, and then the person you trust can help you with your medical decisions or with managing your personal affairs, finances, et cetera. And those two things go together. You're still in charge. The person you picked and trusted is able to help you.
Right, right. And they don't necessarily have to be the same person. Maybe you'd want somebody different to be your power of attorney than to be your
that's a great point.
healthcare proxy, because some people might be more healthcare oriented. Some people might be a little bit more fiscally prudent.
No, I think that's absolutely right. You know, and you don't pick your oldest child because they're your oldest child.
Right.
You pick the person as, you know, the right person for the skills, or the right skills for the job. You know, and I mean, I always related to my life and what my sister said she was good at, or what I was good at, et cetera. So
right,
you really think about it that way.
Right, right. There's another topic to talk about. There seems to be more seniors with developmental disabilities that are out in the community now. Sort of people are aging in place into elder.
This is really elders. True, and I think that probably Western New York is in good shape in that regard. There are a lot of wonderful agencies and people who are working in aging-related fields who recognize this, and so we're getting the groundwork laid for there to be living arrangements and community services and that kind of thing. I think the other thing is that people really need to be mindful about how they handle their estate plan for family members they love who are persons with disabilities. And not just their wills, but the beneficiary designations on their life insurance, on their retirement plans. More and more, the primary asset people have is their retirement plans. And the law has evolved over the last couple of decades to include supplemental needs trusts, which are critically important to making it possible for a person with disability, whether it's developmental disability or an acquired disability, to have a high quality of life.
Right, right. And that basically what that is you don't want to be putting all of your money into that person's name because they may have some kind of, they may be getting some benefits that would be cut off if all of a sudden they inherit.
It can supplement the benefits,
Right.
And pay for things that the benefits don't pay for.
Right.
It can also protect vulnerable people from abuse, and theft and undue influence.
Right.
Or even maybe bad judgment, which does happen from time to time.
That has been known to happen. As far as the Affordable Care Act, from a legal perspective, is there anything that older adults need to know, or anything that you see in the Affordable Care Act that is of interest?
Well, I was listening to you talk with Bill Daniels.